Hi you guys, this is Dr. Dave. I am here to talk about the 7 most common causes of spine pain and why your pain is not random. Back pain is not random, neck pain is not random, sciatica is not random. If you've been told it just happens, or you're getting older, or you'll have to just live with it, that's simply untrue. And I would not want you to go through life in misery. If you've been told that there's nothing else anyone can do, I also would tell you to disagree with that comment. Pain follows patterns, guys. If you don't change the pattern, the pain is always going to be there. And once you understand those patterns, you stop guessing and you start fixing the real problem. Today, I'm going to break down the 7 most common causes of spine pain using real science and explain it in a way that makes sense to you. That way you understand what's going on with your spine without having to think about it or have to run out and spend a lot of money to try to understand what's going on. But if you've been dealing with pain for weeks, months, or even years, this video might be for you. And if not for you, forward it on to somebody that has. Let me help them. Let me explain to them some ideas that might be able to help them recover from some of the pain they're experiencing. Hi guys, my name is Dr. Dave. I'm a chiropractic physician, rehab specialist, and founder of OnlineSpine.ai, where we help people fix spine pain from home using personalized AI-guided rehab programs. I've worked with thousands of patients, and I can tell you this with certainty. Pain is never just bad luck. Something happened. It might be a series of things, but something actually did happen. There's always a cause, and there's always a reason why you have pain. And traditionally with spine, there's usually more than just one. Let's get into this. Let me break it down for you. Probably the number 1 cause of pain is what we call disc dysfunction. The spinal disc is a kind of a tire with a jelly donut. It's got a strong outside called the nucleus fibrosus, and you have jelly-like material on the inside called the nucleus pulposus. Now the stuff on the outside acts like a ligament. It connects 2 bones, so the 2 vertebrae trap the disc in between, and it's used as a shock absorber. The fibers of the disc attach to the bone just like a ligament, so it is a ligament. And the outside of that disc is actually filled with nerve endings. And the number 1 nerve ending is pain receptors. When you injure or stretch out like a bulge of that disc material, you're going to have a lot of pain. But let's start with the worst situation that most people worry about, which is disc herniation. Now remember, discs are shock absorbers between the vertebrae, so they squish, right? So they don't slam the bones together. Typically they have an outer layer, which is called the annulus fibrosus, and an inner gel-like material called the nucleus pulposus. In normal language, like we said, it's like a tire. You have a tire with a hard outside with a jelly in the middle. The disc itself loses hydration, movement, or load tolerance. That jelly or that disc starts to push out. That's called a bulge. And if you tear on the outside and that disc continues to push out, that results into a herniation. Typically a bulge moves into a herniation. Here's the problem with what most people never hear. Most disc problems actually heal. Not all herniated discs need surgery. There are many of us actually that walk around with herniated discs and don't even know it. Because you tweaked or injured your back, it tore a little bit, you had a little herniation, and it sits there for the rest of your life. In fact, there was a study done not long ago where they examined many people, and they grouped them in groups by age. And what they found is anybody under the age of 60 typically has 1 herniated disc in their spine in their 50s. When you get to 65 or older, typically we'll find 2 herniated discs in the spine. And again, there's no symptoms, there's no pain, there's no ongoing agony. Just because you have a herniated disc doesn't mean you're going to have pain, believe it or not. But when you do start having the pain with that herniated disc, that's when we need to figure out why. Because that means the issue is still going on. Pain from disc usually comes from irritation and inflammation. There's usually no permanent damage. But if it continues to get irritated, it's going to cause more pain. Also, discs need to move regularly, and they need to do that to stay healthy. That's why sitting today creates so many disc injuries or disc issues. It's because you're sitting in one area with full load on the spine with no motion. They don't have blood supply like we do with our muscles and the rest of our body. They rely on that compression distraction as we stand up, lay down, sit down, and constantly move. They rely on that motion to pull in the fluid and the nutrients within the disc to keep it healthy. When someone stops moving, because of fear, the disc actually gets worse. That's why bed rest has been eliminated for most back issues. Now I say most because there are some instances where you need to really be careful. Disc pain doesn't mean your back is broken. It means it needs the right movement. If we can get that movement, typically discs heal very, very well, and they do very well. They're very resilient that way. Number 2 cause of back pain. Honestly, probably the most common, we call facet joint irritation. The facet joint is the joint in the back side of the vertebra that allow your spine to move. You have an elbow joint, you have a shoulder joint, you got finger joints. So in the spine, they're called facet joints. Now let's talk about one of the most overlooked pain generators of the spine. It's called the facet joints and the ligaments around them. Facet joints are the small joints on the back of the spine, and their technical name is zygapophyseal joints. Big, long Scrabble word. I know it's great, but no one needs to really remember that. Just say facet joint. Think of them as door hinges. They guide motion, they limit excessive movement, and they're loaded constantly when you sit, stand, twist, or extend. So, they're highly used joints, and you have many of them in your spine. When the facet joint gets off, or stiff, or inflamed, people will start to feel that sharp, localized pain. Oh, it hurts right there. Especially when standing up from sitting or laying down, or how about rotating or leaning back, or you bend forward and it irritates. If your pain feels sharp and stuck, that's probably meaning the joints in the back are the things that are causing a lot of pain. Now, when you have this pain, we also get muscle guarding. That's going to be the number 3 cause of back pain. Muscle guarding and instability. Why? Because the muscles will splint the area that's injured. So if you tear a ligament, herniate a disc, or stretch or bulge a disc, the muscles are going to splint that area. What happens to a muscle that gets really tight? Think of it, it gets really tight, the blood vessel that gets through there gets smashed. If you put a rubber band around your finger and decrease the blood flow, that finger is going to start hurting. So when those muscles go into spasm because they're trying to protect the injury, over time the muscle is going to start having more pain because it has a lack of blood flow. This is where most people misunderstand where that tightness comes from. The spine has big muscles that move you, they have small muscles that stabilize you. And those big ones everyone knows, the small ones you don't know. Because the deep stabilizers, like the multifidi, act like internal scaffolding to help hold up that spine in a nice rigid formation. When those stabilizers start to break down due to stress, injury, or inactivity, your body compensates by tightening around it. Here's a prime example. If you sit all day with your head forward, these muscles are going to fatigue. Then they're going to get stretched and strained. Then they're going to start to spasm. Then you start feeling pain in your shoulder. Oh my gosh, my pain here is stress. The problem is you got to get those muscles to relax by getting the body to move and to move correctly. The tightness feels protective, but it actually is causing you pain. When you go to a physical therapist, chiropractor's pain management, they may give you some muscle relaxers or let those go so we can get blood flow back into there to decrease at least the muscle pain. But that won't change the facet pain, it won't change the ligament pain or the disc pain. But this is part of the process. But here's the key point. Tight muscles usually is a sign of instability, not strength. Something's happened. Stretching doesn't fix it alone. You stretch a muscle, it's got to still do its job. If the cause is still there, if the injury is still there, it's going to remain tight. You have to reactivate the stablers, get the problem solved to relax those muscles. Tight doesn't mean strong either. It could mean very, very weak. In fact, long, weak muscles tend to be very, very tight. Short, strong muscles tend to be nice and relaxed. Usually, tight doesn't mean strong. It usually means unstable. Now, what's the number 1 cause? The number 4 cause of pain, postural overload. We just talked about that. And in today's world, to be honest with you, I'll grab my phone here real quick. We have these things called cell phones. These things kill us because we're like this all day. And our upper back gets tired. Then we see kids lay back in chairs or people sitting like this. Posture is not about sitting up straight, guys. It's about how long you stay in that position. You're going to stretch and strain those muscles in that tissue over a long period of time. You're going to have problems. Your spine hates to sit still. I have a 3-year-old right now. He's always moving, right? I need to get better at that. But the more I move, the better I feel. So if you go to the gym and you're working out modestly, but you're doing it consistently, you're going to feel very good. But sitting for long hours, looking down at phones, looking at your computer screens, all of this loads the spine in one direction for way too long. You have to change that. Over time, this tissue adapts poorly. Muscles start to weaken, the joints will get stiffer, and the discs no longer can compress and distract. As we talked about, it needs that motion to hydrate. Then the pain starts to show up exactly where the overload is the greatest. The problem isn't your posture, it's how long you stay there. And this is where we get a lot of confusion for people. Look guys, you gotta keep moving. Even if you work all day at a workstation, IT is big, cell phone use is huge right now. All of this is causing spine degeneration, mainly because we're not moving. Simple thing called moving or motion is really important. Flexibility, mobility also become important in that as well. All of this actually leads to one thing that we really get concerned about, which is nerve irritation. Nerves are incredibly sensitive organs, as they should be, because that's why they're called nerves. But they can swell. Inside the myelin, the nerve itself can actually swell. When the nerve swells, it actually causes a lot of pain. But also, they don't like compression. They don't like to be pushed on. A herniated disc or a hole that's gotten too small for it will cause that. And they definitely don't like that inflammation that it causes. When discs, joints, or muscles irritate a nerve, then the pain can travel down the arm or the leg. Now, depending on how far it goes down, will tell us as practitioners, is it just nerve irritation or is it nerve compression? That's why people call sciatica is nerve irritation. But why did the sciatic nerve get irritated? When I say to a patient you have sciatica, that's an adjective. I'm telling them what is going on, but not the cause. If your doctor tells you, oh, you got sciatica, you got to ask him why. Why do I now have sciatica? It didn't happen just because. The nerve itself usually isn't damaged, it's irritated, it's swollen, and you got to figure out why that is. If you calm that irritation down and you restore the movement, reduce that inflammation, the nerve will settle down and it usually will do better. Yes, there are medications out there, but I just had this happen the other day. A bag of ice out of your freezers. I call it water-based ice. Just ice cubes made with water, put it in a plastic bag. Most people can handle just putting it right on their skin. It won't hurt you. Usually the water melts faster than the ice is cold. Now, if you're using any chemicals or if you add anything to that ice water or using a gel pack, acutely that's very, very cold. It can burn your skin, so you have to be very careful. But if you're using water-based ice, pretty much put it on your skin, it's not going to have a problem. As long as you're only icing between, I'm going to say 12 to 15 minutes. But remember this, nerve pain usually means nerve irritation, not permanent damage. There's a big difference, you need to understand that. Let's talk about this thing called inflammation, which is the sixth cause of spine pain. Inflammation amplifies pain signals within the body. The nerve gets really, really irritated. You don't want to do that. You don't want that inflammation to get into the nerve because it causes a lot of problems. Now, it doesn't just have to be mechanical pain either, or a pressure on the nerve. Poor sleep, high stress, processed food, dehydration, lack of movement, all increases inflammation in our body. You ever eat that food, that goodie, and man, your stomach just blows up? That's inflammation. You're inflaming your stomach. That inflammation is going to start circulating system-wide. That's why if you look at all these gurus out there talking about nutrition and lifestyle, they're talking about getting rid of the inflammatory foods, getting rid of inflammatory habits within our body. Because even the small little inflammation is going to create a tremendous amount of problems. When inflammation is high, even small mechanical issues feel even worse. We decrease the overall body inflammation, you actually deal with pain much better. That's why when pain flares, usually during stressful periods, even without a new injury, if you've ever had an old injury, but man, it's really flamed up today, I don't know why, look at your stress load. How about your sleep or your food that you've just eaten? Your spine doesn't exist in isolation, guys. It is a main structure of your body. It responds to your lifestyle. So people who come in and say, oh, is my mom's genes this, genes that, genes, no. It has everything to do with your lifestyle. Very similar to teeth. Dentistry and chiropractic, I think, are in the same industry in the sense that we can predict your health by looking at your mouth, how are your teeth, and how is your spine. Yes, there are congenital issues. Yes, there are genetics. But we have so much technology, we have so much knowledge today that you can override that genetics to some extent to keep you from going down the same path. Ultimately, inflammation turns the volume knob up on pain, and you have to be very careful about that. The last cause of spine pain that we see quite regularly is stress and nervous system overload. We've been talking about that with nutrition and lifestyle because that's what overloads our whole system. And when the whole system gets overloaded, the first thing to get the most pressure on it is the nervous system. Your spine and nervous system are inseparable. Chronic stress increases muscle tension and bad posture, which creates ligament tension, which creates more muscle tension, which creates more inflammation, and it lowers your pain tolerance because you have so much of it going on, guys. I don't want you to have that problem. Your brain decides how much pain you will feel based on safety, stress, and previous experiences. That's why chronic pain patients maybe they've been in pain for 10 years, they're really difficult because the brain remembers and it'll keep that pattern even if the body is healing. Then we have a whole different issue to deal with. This is why fear makes pain even worse. The big example is my wife giving birth to our son. She did it without medication, but she went in it knowledgeably. Did it still hurt? Yes. Did it hurt as much as somebody who didn't know that? Probably not. She knew what was coming. I will let her speak for herself, but she will tell everybody how much better it was to go through that process, understand what's going to happen before it happens. Remember, pain isn't just physical. It can be neurological as well. Here's the truth that most people have never heard. Pain is rarely just one cause. It's usually a combination of mechanical stresses, movement deficiencies, inflammation, and nervous system overload. Yes, you can do a chiropractic adjustment and get some benefit. Yes, you can go to physical therapy and get some benefit. Yes, you can go to massage therapy and get some benefit. The problem is random treatments fail. This needs to be a coordinated effort. Understand what is the cause, work on solutions on that cause, have the right providers do that, and then you need to change your lifestyle. That's why random treatments don't fail. If we are specific about what we're doing, we're going to win every single time. And that's why personalized care works. And that's why I created OnlineSpine.ai. OnlineSpine.ai is a tool for you, and the front end is free. And if you want even more help, you can pay as little as $10 a month or $50 a month and get all the individualized help that you need. In just a few minutes, you can complete a personalized spine assessment that identifies which of the causes you're having difficulty with and gives you a clear step-by-step plan how to fix it safely at home. There's no guessing, there's no generic exercises, and no fear because I'm going to teach you why you're having the spine pain. If you're really ready to understand your spine and take control of your recovery, visit OnlineSpine.ai today. I'm doing this for you because it is really this simple. It's not as complicated as people think it is. Now, if you wait too long and you let that spine just rot right out of your body, you're going to have a lot of issues. And yes, there's things like scoliosis and spondylosis and spondylolisthesis and all these complicated things. But believe it or not, most of these conditions can be treated without surgery if you catch it in time. If this video helped you, I want you to like it. I want you to subscribe and comment below and let me know where you feel pain. Where is it? And why do you think it's there? Do you have neck pain, mid-back pain, low back pain, or sciatica? I'll cover it in upcoming episodes. We're going to cover all of these topics just for you. But again, a free online service, you can review it real quickly. If you want to move forward, you can. Pain has a cause. Your spine can heal. And I can see you in the next video. Have a great day.